The presentation is entitled The Conversion of Failed Total Shoulder Arthroplasty to Hemiarthroplasty, Clinical and Radiographic Evaluation. I would like to thank my co-authors. Total shoulder arthroplasty is often indicated for symptomatic glenohumeral arthritis. Glenoid loosening is a frequent cause of failure which requires revision surgery. 75% of the patients were subjectively better or much better following revision to hemiarthroplasty. Interestingly, all patients in septic group had satisfactory results. Glenoid remodeling was seen in 14 of 20 patients, defined as sharp demarcating or thick sclerotic line. In the picture, there's the sclerotic line at glenoid side. This glenoid remodeling sign did not appear before 1 year postoperatively. There was no correlation between bone grafting and glenoid remodeling. Here is one example of a patient who showed unsatisfactory pain relief at 1 year postoperatively. As you see in the picture, there is no glenoid remodeling yet, but at 3 years postoperatively, after developing a sclerotic line at glenoid side, the patient showed satisfactory pain relief. We conclude that conversion of failed total shoulder arthroplasty to hemiarthroplasty can produce favorable results. Glenoid remodeling sign after 1 year postoperatively is associated with satisfactory pain relief. Thank you.
I think, Dr. Bigliani, if you're still here, maybe you can comment on what you're doing currently for the glenoid, the type of bone graft that you're using. Are you using autograft, allograft, and what's your current choice?
If you do any acetabular work, this is where we got the idea. You usually hold the graft with K-wires and then you ream into the graft so when you put your implant on.
And you convert back to a hemiarthroplasty. Are you treating the soft tissue defect specifically when you convert from a total to a hemi?
Well, all the material was from the Bigliani, but as far as I reviewed all the cases, like he tried as far as he can do to repair the especially like the anterior subscapular deficiency. But like there was one case that it was impossible to repair. Then we transferred the pectus major as a therapy for the subscapulars. But still, the clinical outcome was worse than the patient who had intact subscap.
3 papers. The first paper we'll be hearing about next is antibiotic-loaded bone cement, primary and reverse total shoulder arthroplasty.